A report on the first 3 years of a program tasked with improving access and choice for mental health and addiction services has been released, and it shows a growth in kaupapa Māori services and higher rates of access to youth services for rangatahi Māori. Hayden Wano no Te Atiawa Taranaki Ngāti Awa is chair of the Te Hiringa Mahara, the Mental Health and Wellbeing Commission, and is with us now. Tēnā koe, Hayden, thanks for joining us.
Tēnā koe, Neil.
Now, what are some of the key takeaways from this report, and what does it say about the progress that's being made?
Okay, so some of the overall progress that's been made has been very encouraging across the broad spectrum of the program. There are four key parts to the program: access to mild and moderate services and general practice settings, kaupapa Māori, Pacific and youth, and good progress has been made. Falling a little bit behind with the 150,000 target overall for the period up to June 2022. So about 114,500 people were seen in those services. When we shift our focus to the areas that you just referred to, very encouraging results for in kaupapa Māori. We've seen an increase over that year to 30 June 2022 of an additional 17 kaupapa Māori providers. And I think one of the things that happened there was that the approach, was a different approach taken so that we could introduce, and so 17 of those providers, many of those providers were new to this particular field, so there's a focus on trying to build capacity. So another key highlight from that particular piece of work is that kaupapa Māori providers are also recruiting well into the areas, and when you see what's happening and the pressure on workforce to get workforce in, that's a particularly heartening outcome.
Well, this is good, right? It sounds good. Now, funding for the Access and Choice program began in 2019 and is now halfway through. Do you feel the investment, it sounds like the investment has been well spent. Do you feel it's been well spent, and is it doing enough to address the issues identified in He Ara Oranga?
Look, it will go some ways. It is a positive investment. We have to acknowledge that. And you know, as I said, 114,000 people received services that they wouldn't have got in the past. In the past year, we had 20,000 Māori accessed across all of those streams, and 8,000 through, or nearly 9,000 through kaupapa Māori organisations. So some progress has been made, but there's some headwind in the system, and I refer to that, particularly around the ability to attract workforce into this area. There are some really good opportunities to grow in this particular area. A lot of the pressure is around access to clinicians, specialists, but we also have grown a lot of workforce in people with lived experience and people with the cultural support background. So those are two areas that we could see adding and taking some of that pressure away from existing workforce pressures. Okay. And we could bring them on in a relatively quick space of time.
Now, a recent Ipsos survey paints a fairly bleak picture of the mental health space, not only with the cost of living, but also with COVID-19 exacerbating an already troubled sector. What do you feel are proving to be some of the most challenging issues to overcome?
Well, that is in fact part of the challenge. So in addition to the supply side of staff, there's the demand side, which is growing, and you particularly see it in the younger generations. In that Ipsos report, it does point out that there's a sort of a two-tiered approach. For people less than under 50 are more likely to experience distress and extreme distress as opposed to older people. So that is one of the challenges. One of the things that we did pick up with this particular program was that a lot of people aren't aware of it. And I think, so I think growing some awareness will go some way, particularly in relation to this program in the short term. In the long term, there's a bigger challenge around workforce, and it's very clear that we're going to have a longer term view. This issue that we're facing around workforce has been some time in the making, probably decades. Okay. And so the process of getting out of it is going to take us some time as well. It's going to require sustained leadership over time across from the political leadership through to system leadership, and it's going to have to require some clear accountabilities about how that plan should be undertaken. But that's a piece of work that's not clear yet.
Okay, nice to hear some positive news in this space. Hayden Wano from Te Hiringa Mahara, thank you so much for your time today. Ngā mihi.
Kia ora ni o ngā mihi.